Hello, everyone. Good evening, all of you. So, yeah, 2 minutes is for 9 p.m. Okay, let's wait for 2 minutes. So, okay, so guys, almost correct sharp 9 p.m. is the timing. So, let's solve some questions. Already we solved 85 questions in the yesterday's book, right? Hi, Yuvareka. Good evening. So let us solve some more questions in this session. Okay. Solve this 86th question. A 10-year-old had a cochlear implant in his left ear few weeks ago. Today he sees the audiologist to initialize the program, uh, uh, to initialize and program the implant. What CPT code is reported? Hi, Monica Yadav. So what will be the correct CPT code for this encounter? Hi Venu, good evening. Solve this question. Actually, no, these questions are in 2 pages, guys. So that is why, yeah. Now it's clear, guys. Very difficult to find, I know. Okay, Yuvarega, option C, Venugopal, option A. Okay, let me check the option. Just a second. Almost one more option is also there, right? Yeah. Hmm, okay, let me check the answer. Actually, here A is the correct answer. Okay, option A, 9260603 is the correct answer. Okay, Venu, you are right. Okay, yeah, Anjali, correct answer. Hi, hello, Agash Kumar. Okay, here option A is the correct answer. Okay, okay. So let me take another question. 87. Actually, this question, a patient experiencing chest pain and difficulty swallowing present to her gastroenterologist office for gastroesophageal reflux GERD testing. Okay, the patient undergoes the GERD test mm, with placement of nasal catheter electrode for a 24-hour period. At the completion of the reflex test, the physician performs an esophageal manometric study of the gastroesophageal junction. The physician also performs supervision and interpretation portion of each study. So, what CPD coding is reported for this encounter? Solve this question, guys. Actually, it's from for medicine chapter question. Okay, what will be the answer for this encounter? Yes, Monica, correct, Agash, right? Yeah, no, no. Before that, no, no. Check the code, guys, both of you. No, not answer is not A. Hmm? Check your code once more. What about 91034 code? 91034. What is the code? Yeah, sure, Monica. Actually, uh, we have no normally 9 p.m. is my live time. Okay, I will update you about the timing. Okay, I no always I update my live time in this my YouTube channel through my YouTube channel. Normally nowadays, yesterday, today, or I'm giving 9 p.m. every evening. 9 p.m. is my live session. Okay, happy to see you there. Someone says option A, someone says option B. Okay, let me check the code. Okay, together. So actually here the code is 9. Okay, here 91037 is there, 34 is also there. Okay, let us check the first code 91037. Okay, mm, 91037. Actually the code is for a that is for esophageal function test, gastroesophageal reflex test is mentioned. Ah, okay. Here. What is the patient undergoes gastroesophageal reflex testing? Yeah, that is correct one. With the nasal catheter, intra-aluminal impedance is mentioned. What about 37? Okay, oh sorry, 37 is this code. Okay, what about 34? Let us check the 34 also. 34 is esophagus gastroesophageal reflex test. 37 is for esophageal function test, right? Actually, here I want to take the code for a 37 contain intra-aluminal impedance electrode placement, recording, analysis, and interpretation. 34 contain esophagus gastroesophageal reflex tester with the nasal catheter pH electrode. Nasal catheter pH electrode are mentioned in that code. Like um, catheter. Wait. Catheter pH electrode is mentioned. Hmm. Uh, Here also 37 also mentioned some electrode, right? Okay. Mm. One more thing, guys. Check the code 91034. You can see that here in our question, difficulty in swallowing is a patient experiencing chest pain and difficulty swallowing, right? Difficulty swallowing. So, check the code 91034. Esophageal acid reflux test is in your textbook. There will be a description. Explain 91034. It contains a catheter with a pH electrode is placed into the esophagus either through the nares or swallowed to measure esophageal pH. An indicator of gastric reflux is mentioned. Okay, so it is in our question also swallowing condition is mentioned, right? Okay, so it is a little bit matching with our 3 4 code is matching with our current procedure. Whatever, just to check the other option 91010 also. 91010 actually for esophageal motility manometric study. Yeah, we have manometric study is mentioned in our question. Okay, esophageal manometric study for the esophagus and our gastroesophageal function is mentioned, right? Okay, here also esophageal manometric study is mentioned. So the code 91010 is esophageal manometric study, right? Am I right? 91010 is the study of esophageal manometric. So the answer, you can eliminate option A and option C. Both are wrong because check the second code 91020, it is related to gastric motility manometric study. But we want esophageal manometric study. Okay. So eliminate option A and C. So the right answer is option D because modify 26 is mentioned in last code option D. Already in our question paper, in our question, the physician also performs supervision and interpretation of the study, right? So you have to add a modifier 26 along with the code. Okay, because already 91034 code contain interpretation and report. Okay, I know because it already contain interpretation. But the second code 91010 it doesn't. Yeah, already that is also contain interpretation and report, right? So here both the codes are explaining the interpretation and mm, supervision and interpretation of study. Okay. Um, what will be the answer? Patients undergo 24 hours completion of. So yeah, you have to take option D as the right code here. Okay, D is the last one is the correct answer. Okay, okay, check the code. Last one is the correct answer 91034 modify 26 91010 modify 26 is the correct answer. Here, both the code explains interpretation and supervision, right? But you have to code for extra for both the interpretation and report. So 9103426 and 91010 modify 26 is the correct answer. So here is our in our answer key, option D is the correct answer. Okay. So you have to take option D, 91034 modify 26, 91010 modify 26 is the correct answer. Okay. Yes, solve this 88 question. Amuda. Amuda, option B. You mean 88 option B? Think about okay. If anyone just if you get the code, just comment below. Yes, Sandeep, correct answer. You are right. Option D is the correct answer. Okay. Option D is the correct answer. 93923. Okay. 93923 actually. The code is for 93923. The code, it is for complete bilateral non-invasive psychological study, sorry, physiologic studies of upper or lower extremity arteries, three or more level. Some kinds are mentioned. So it's a big paragraph. The main specialty is that code is three level, right? Three or more levels you can code 93923. Okay. So in our question, how many levels are mentioned? Three level. Okay. The arterial diagnostic procedure will examine both arms and forearms at the three levels. So yeah, Monica, correct answer, dear. Three level is Shakti, correct answer. D is the correct answer. Last one, 93923 is the correct answer. So here they have mentioned three levels. So you can take, yes, yes, I will share you. Actually, in this question, they have mentioned the arterial diagnostic procedure will examine both arms and forearms at a three level. Okay, it's a level based question, guys. So in our question paper, they have mentioned three levels. So check the code 93923. You can see that three or more levels are mentioned. You can take that code. That is under the extremity arterial studies. Extremity arterial studies related codes. So three or more levels are mentioned in your question. You can take 93923. Okay, so here three levels are mentioned, so you can take 93923. That is why we take a 93923 for three levels. Okay, others are 922, it is for a one or two levels. Okay, no need to take that. Here, three levels are mentioned. Clear? Agash? Others also, Yuvareka and Venu. Clear, guys? Amuda? Okay. Okay. So, yeah. Let me take the another. Yes, Yuvareka. Okay. Okay, Agash. Okay, Venu. Thank you. Thank you for your response. 89. Yes. A 5-year-old patient 5-year-old patient has a fractured radius. The orthopedist provides moderate sedation and the reduction. The time is documented as 21 minutes. So what is the CPT code for this moderate sedation code? Actually, it is very easy to find. Actually, one arm or leg is available for study. You can report 93922 for a unilateral 3 or more levels performing productive function one. Okay, not a matching dear. Actually, 93923 is the correct answer for three or more. Yeah, I find the bracket parenthesis note. Okay, but not Sandeep. What about the score 89? Yeah, D, correct answer. Very good, Sandeep. Okay, very good. Correct answer. D is the correct answer. 99152, that is related to moderate sedation code. It is present in your medicine chapter, guys. Okay. Actually, it's a EAN code, but it is present in the medicine chapter. Very good, Sandeep. Yes, Agash. Correct answer, dear. Yeah, sure. 99151 and 99155. Okay. Uh, I will share the difference, basic difference between both the code. Okay, just now. 99151. Now let me take the code. Yeah, actually 99151 and 99151, that is for moderate sedation code here. That is provided by the same physician or other qualified healthcare professional. You can take 99151 moderate sedation code. What about 155? That is for a moderate sedation provided by a physician or other qualified healthcare profession other than physician. Okay. So other than physician means any nursing background, any nurses, head nurses, or any other given moderate sedation, you can take 99155. Okay. Clear? Other than physician is mentioned. Just to highlight the code, you can see that 99151, it is based on the moderate sedation by same physician. Just highlight the same physician. And also 99155, just highlight moderate sedation services provided by a physician or other qualified healthcare other than physician. In your question paper, other than physician was mentioned, you can take 99155. In this case, orthopedist is mentioned, right? Orthopedist is mentioned. So orthopedist is a physician, right? It's a physician. Yeah, Monica, correct answer. 99152 is the correct answer. Okay, orthopedist is a physician. So you can take 99151 code. Here also younger than 5 year of age is mentioned. 5 year or younger than 5 year of age, you can take 99152. Hmm? And also about the timing, here 21 minutes is mentioned. Okay, so what is the basic difference between 5-1 and 5-5? 5-1 is for same physician and 5-5 it is for other than physician. Any other qualified professional. Any other means other than physician means it may be become head nurse or any other other than physician. You can take 99155. Clear, Agash? Yeah, that is I'm explained, Monica. Actually, 151 and 155 means read both the codes. 151 is a moderate sedation by the same physician. So physician, it becomes related to physician. And 155 it is for other than physician. Other than physician means not a doctor or any other head nurse. It may be become head nurse or any other uh, professionals can give moderate sedation. You can take 99155. Okay, excluding physician. Okay, clear, Monica? Okay, Agash Kumar, clear. Okay. 19 to 1. Okay, welcome, dear. Hmm. Actually, it is related to, it's a theoretical question. Okay, it's a related to simple a problem based. What type of problem is considered? So just to check the MDM table in your CPT, you will get an idea about this question. Yeah, very good, Mugesh Selvam. Correct answer, dear. Yeah, Sandeep, correct answer. Yeah, Shamim. Yes, dear. Stable chronic illness. Very good, Shamim. Smart deals, correct answer. Agash Kumar also correct, dear. Actually, in this scenario, what type of problem is mentioned in our question? Miranda is in her provider's office or follow up of her diabetes. So her blood sugar remain at a goal with continuing her prescribed medication. So what will be the, when referring the NDM table in CPT book, number and complexity of the problem addressed at the encounter, what type of problem is encountered here? Miranda is in the stable chronic illness stage. Okay, Miranda in her, stable chronic illness condition. Okay, kidney one. Ah, okay, okay, okay. Okay, Akash. Ah, you can expect this kind of questions. Okay. Almost, guys, everything in your exam, in your main exam also, you can expect these kind of questions. Almost all the questions are in this same type. Okay, same type, same scenario. Yeah, very good. Sandeep, you are right, dear. Option A. Here, option A is the correct answer. A 67-year-old is seen by his primary care physician for an annual exam. So, annual examination is mentioned, and also mm, his last exam with the primary care physician was 2 years ago. He has no complaints, right? 993 97 is the code. So, 99397, actually, the code. Yeah, 99397, that is for an established patient, right? It's an established patient because here the patient is not a new patient. It's a established patient because already the patient is seen by his primary care physician. It's an annual checkup, annual examination, annual checkup. So already it's a established patient case. So 99397, it also, it is related to 65 years old and older. So here the patient is 67. Yeah, so um, this is the correct answer. Okay. Akash, correct answer, dear. Smart deal is also correct. 92. Mugesh, yeah, correct answer, Mugesh. Yes, Sandeep, you are right. Agash, correct answer. Option D is the correct answer. Okay, you are right, guys. Actually, patient present to pulmonologist office for first time. So first time means it become a new patient, right? First time. Clearly, they have mentioned the patient is a his first time visit. So it will become new patient. And then what is the next, they have mentioned the patient has a coughing and shortness of breath is there, history of asthma, okay, And physician perform medically appropriate history and examination. Okay. And following labs are ordered. Some arterial blood gas, sputum culture. Okay, everything is mentioned, right? So, uh, 99204, that is the correct answer. That is for a moderate level of medical decision making because the patient has some symptoms is there, right? So you have to take a moderate one. Okay, so option D, 99204 is the correct answer. Monica, correct. Devishri, correct answer. Venu, correct answer. And Shakti, correct answer, dear. Uh, Rasna, nice name. Okay, Rasna, correct answer, dear. Smart deals, right answer. Okay, very good, guys. Yeah, very good. Key point prescription by medication level moderate 992 notes. Okay. Yeah, and also MDM3 lab test was performed, so it will be moderate. Very good, Monica. Yes, yes. Actually, it's a very good because you have some, already you have a little bit knowledge in E&M, right? So that is very helpful for all the students. Okay, while typing this in the comment session, also, uh, you know, it will, increase your confidence for your examination also, guys. Okay, very good. Here also lab tests are performed. CBC, arterial blood gas, sputum culture, everything is there. So you can take as a moderate one. Also some symptoms are also mentioned. So all the conditions are exactly matching with the moderate sedation, moderate complexity. So you can take 9924, 93. Also one ICD code is also there. CPT is there. You can expect in your examination CPT plus ICD codes. Okay. Very good, Sandeep. Correct answer, dear. Mugesh Selvam, correct answer. Here is also 93, question number 93. Option D is the correct answer. 99344, J45.901. Yeah, yeah, Venu Gopal, correct answer. Venu, not a Venu, Venu Monica. Yeah, Rasna, she correct answer, dear. D is the correct answer. Very good. Here 94, option C is the correct answer. Yeah, very good. Akash, what did you say? J45.901 explanation. Okay. J45.901. That is for J45.901. That is for unspecified asthma with an acute exacerbation. Okay. So actually that mentioned in your question paper, dear. Unspecified asthma with an acute exacerbation, because already the patient has a history of asthma, right? So and also the physician assessment is acute asthma exacerbation, clearly mentioned in our uh, session. Physician assessment is an acute asthma exacerbation. Okay, so that is why J45.901. Yes, smart deals correct answer. C is the correct answer. Yes, Devi, correct answer, dear. Yeah, Sandeep, actually this question, you can just check the question in your textbook. You will get an idea because all these options are the heading. Hmm. Already the patient is admitted in the observation care on 12, uh, 12 2. Okay, 2000 something. Okay, and again, the ED physician required the patient to stay overnight. So already the patient is stay for stayed. Okay, patient is admitted and overnight the patient will be stay at overnight. So what total observation was 16 hours. Okay, so how will you code that? For which area would you choose for coding this scenario? Yeah, yes, actually it's a paragraph question, guys. Okay, already the patient is in observation care, admitted for patient admitted for 1 day, and again the next day the physician required the patient to stay overnight. So the next day discharged the patient. Hmm. Okay, so total 16 hours the patient stay in the observation. Okay, so this is the exact procedure here. So, which area would you choose to code for this scenario? Hospital inpatient or observation care services is there, including admission and discharge service is there, and hospital inpatient or observation discharge service is also there. These all these are the like again one of the option is also there. All these are the um area or series of the series. Okay, all these are the area heading area, guys. So, which area would you choose to report this code? Patient is admitted overnight, then discharged tomorrow. Total 16 hours stayed. I mean 16 hours in the observation care. This is the procedure. So for this scenario, you have to take option C. This is the correct answer. C means initial hospital at inpatient or observation care. I mean starting stage. The patient is came to the hospital for a normal observation. So it will become initial. And the patient is admitted, again he discharged, so it become hospital inpatient or observation discharge services. Yeah, Monica, C is the correct answer. Yeah, Venu, C is the correct answer. Very good. Very good, Sandeep. B is the correct answer. 9922223123 you have to report the what is the E&M coding is reported by the physician for the patient in observation care. So you have to report only for the observation care code, right? So 99222, that option, I mean B. B is the correct answer. That is for initial hospital inpatient and observation care code. B is the answer, dear. Just to check yourself. Okay, after the yeah, it is related to HIPX level code. That is for 99222. That is for a initial hospital inpatient care observation care, dear. Actually, Actually, the code initial hospital inpatient observation care means already in our question they have mentioned how what E&M code is reported by the physician for the observation care, right? So you have to code for the observation care. So after reading the question, you will get an idea about that. It will become 99222 because only that code describes the observation, appropriate observation code. Okay. What about 96 that is related to HIPICS level textbook? I hope everyone have an a HIPICS textbook in your side. I don't know. Some institutions were not providing any HIPICS textbook. That is why I asked it. HIPICS level code. Which series of codes are needed for claim processing purpose? I mean, it's a temporary service that would be assigned as CPT code. Which series? If you don't know the answer, I will explain it. It become, what is the answer for this question? The answer is Q codes. Okay, Q codes is the temporary service codes. Yeah, sure. Q codes. Q codes is the temporary service code here. Just to note it down in your textbook. Actually, in HIPICS, temporary codes are Q codes, G codes, C codes, and S codes. Okay, Q, G, C, and S. All these are considered as the temporary service codes. Yes, Agash, Q codes is the correct answer. Q code is the correct answer. It is for a temporary codes. Not only Q, but also G is there, C is there, S is there. Okay. So based on our option, Q code is the temporary service. 97. Okay. Gauri Raman. Yeah, D is the correct answer. I think Gauri is my student, right? Yeah, Monica, right? Option D is the correct answer. 90, yeah, we know correct answer. 90674 and G 0008 is the correct answer. 90674 actually the code is for a influenza virus vaccine related question. I mean, administration code. Okay, that is completely that is formulated for a preservative and antibiotic free. Okay, that is related to our actual administration procedure. 90674. Yeah, Yogesh, Venu, correct. Yeah, sure. G 0008. Let me check the code. G 0008. G 0008. Um, the code G 0008 is used to report the administration of an influenza virus vaccine for Medicare beneficiaries, dear. Okay, that is also administration code of an influenza virus. Actually, this code, this code covers the administration itself, not the vaccine product code. And you can use it. This code is used for all ages. Hmm? You can use this code along with our normal administration codes. That is also related to influenza virus vaccine code. Can use this code along with any other or normal administration vaccine code. So here you want to report the vaccine and administration, right? So in our all the options you can directly see that G0008 is a common one. Okay, so you can 100% sure you can use this code along with this administration. Okay. No, no, above 65 year not mentioned. Okay. Actually, this code G0008 is you can use this code 18 and over. Okay, 18 and over, not 65. It's an administration code you can use along with this vaccine and administration code, guys, and it is related to 18 plus. Okay, age mention 18 or above. 98. Guys, and one more thing, you know, I have a 10 days CPC workshop program is also here. The classes are in Google Meet, 2 hours of daily classes. Okay, so if you are interested to join my 10 days CPC workshop program, just DM me. I also pin my mobile number in this comment box. Okay, just check out, or you can mail through midcodeeducation10 at gmail.com or 9037038006 is my number. You just DM me. I will share all the details related to 10 days CPC workshop program. And about the classes, our classes are in English, Malayalam, Tamil languages are available. Okay. So if you are interested to join, just DM me. In throughout the class, we discuss lot of mock papers and previous month question papers and homework mock papers also, chapter wise revisions. Okay, and if you have any doubts related to any topic, you can directly discuss in our classes. So you can directly tell me I will clear all your doubts within the class. Okay. 98 actually, yeah. What is the answer for this? Again, check Agash and Rasna. D is the correct one. What coding is billed for the laceration repair is mentioned. What coding is billed? Billed for the laceration repair is mentioned. So what will be the code? What about G0168? Yeah, C is the correct answer. Nishida. Nishida, you are right. C is the correct answer. Check G0168, guys. One just to check G0168. Check G0168. You will get an idea about that. That is the correct answer. G0168 is the correct answer. Yeah, 99. Yeah, Yogesh. Correct answer. Dear, superficial was mentioned, but you don't need to add that code. What code is billed? Billed is mentioned. What code is not reported? Actually, they have mentioned what code is billed. So it become HIPIX code G0168. Not be confused, okay? Here is also answer C is the correct answer. Okay, not A, Monica. Just to check the code here. 00834 is the correct answer. Okay. And also 99100 is a mandatory one because in our question, 6-month-old baby is mentioned, right? So you have to add the 99100 code. Sorry, no need to code that because already 00834 contains 6 month. I mean, 00834 contains the age of the baby. So option C is the correct answer, dear. Okay, option C is the correct answer. 00834 is the correct answer. No, 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 no need to. What nonsense are you talking, dear? 99100 it is for a younger than, okay, that is okay, but check the entire procedure. Hmm? What is the procedure mentioned in our question? Hernia, internal hernia repair is mentioned. So check the procedure 00830 and 834. Then take the appropriate one. C is the correct answer. Got it. Okay, good. Okay, check the procedure, guys. 830 and 834 is there. So check clearly, carefully both the procedure. You will get an idea about that. 00830 and 834 is there. 34 mention younger than 1 year. Yeah, 834 mention younger than 1 year. So you don't need to add separately 99100 code along with that code. Okay. So option D is a wrong one. And Also 00830 is also wrong. The procedure is it's not a appropriate one. So you can eliminate A and B also. Final option C is the correct answer. Yeah, yes. 00834 is not reported with 99100. Yeah, don't need to report that. Okay, option C. 00834 contain already the 6-month-old baby. 6-month-old baby's code is also present in 00834. You don't need to extra, separately report it. Okay. Actually, every parenthesis notes are very important, guys. So after you are reading the entire option, you can just check the parenthesis note also. Okay, that is very important. Here is our last question, 100. Okay. Yes, Nishita, correct answer. Yogesh, correct answer, guys. Very good. Here, option C, 01961 is the correct answer. Yeah, Monica, correct answer, dear. Yes, Rasna Rashi, correct answer. C is the correct answer. Venu, correct answer. Why option C, map? Actually, 01961, check the code in your textbook, guys. 01961. Check the code and again read the question. 01961 is the correct answer. 01961, actually the code is for anesthesia for a cesarean delivery only, right? So in our question, what anesthesia code is reported for this procedure is mentioned. Also, the patient who is in 37-week gestation, right? Admitted to the labor delivery for a cesarean. So, what is the procedure here? Cesarean delivery, 37 weeks of gestation. Anesthesia code, you want to report anesthesia code. So, anesthesia for cesarean delivery. It is very simple. Yeah, that is the procedure. Anesthesia for cesarean delivery. Okay. Yeah, Monica. What about tomorrow's timing? Almost similar. This timing is okay for you. 9 p.m. Okay. Tomorrow I will take a new mock paper. Yeah. Okay, Agash too. So tomorrow I will take a new mock paper, guys. So same timing. Okay, 9 p.m. Okay. Everyone enjoyed it this live. I hope everyone have loved my live stream. So yeah, a maximum I will try to do uh, live in every day. Okay. So tomorrow the timing is almost similar, 9 p.m. Okay. Is there any changes in the live? I will update in the post session. Okay. Anyway, yeah, most welcome, dear. If you have any doubts related to or any queries related to medical coding or a CPC examination or any mock test papers, just DM me. Okay, I will just pin my mobile number in the comment section. So just message me. Okay, just a DM me. Yeah. Okay. Sure, Monica. Okay. So thank you all of you. Thank you for all your support. So if you have any doubts or any queries, just DM me. Okay, 9037038006. Thank you, Rasna. Thank you so much. Yeah, so thank you, Agash. Ritik, E&M. Ah, sure. We will do E&M questions. Okay, let's practice E&M questions also. Yeah. E&M is also there. A lot of series wise questions are there. 10K, 20K, 30K is there. Okay. And yeah, so we will practice more questions. We done. Okay, MDM level. Medical decision making table, right? Yeah, sure. Yeah, and okay. Okay, Ritik. Let's solve some questions. Okay, okay. And if you have any doubts related to CPC examination, I think all are ready to do your CPC examination in coming upcoming December. I mean, in coming weeks or in this December month or January. May I know your date, please? Tell me a website for practice. Normally, Ritik, there will be no free website are not available in our in our Google or any other site. No free website is not available, guys. All the websites are for paid work. Okay, CPC practice questions are paid. December 24th. Okay, first attempt. Okay, all the best wishes for your examination, Monica. Okay, yeah, okay. Oh, December 18th, Veera. Okay, and Monica and Veera, are you from? Uh, may I know your native place, dear? Yes. Okay, Agash. Okay. Agash is also my student. So, First of all, I want to know your current status of your, current status. After that, I will update you. Okay. Uh, Eluru. Eluru means it's Tamil Nadu. Monica, are you from Coimbatore? Yeah, okay, Tamil Nadu. எனக்கும் தமிழ் தெரியுமா? கோயம்புத்தூர் தானா? Okay, nice. Yeah, Andhra Pradesh. Okay. Yeah, okay, okay. EP, okay. I have students from Andhra Pradesh, Veera. Okay, fine, fine. How is your mock papers? How is your score? Mettupalayam. Okay, Monica, எனக்கு தெரியும். Mettupalayam எனக்கு, yeah, I know. Mettupalayam is almost near from my home place here. Okay, Mettupalayam is almost nearest from my home. Any other queries, guys? 76 percentage. Okay. Oh, your current score. Okay. Ah, practice make you easier, dear. Okay. So maximum practice yourself. Okay. Maximum practice yourself, you will get a better score. Because without practicing, the examination is not easy. Everyone says that it's an open book examination, so it is very easy for very easy to do all the exam, but not at all because it's a complete 4 hours of continuous examination. So கொஞ்சம் difficulty. நான் உங்க வீடியோஸ் முன்னாடியே பார்த்திருந்தா உங்ககிட்ட ஜாயின் பண்ணியிருப்பேன் மேம். அப்படியா? மோனிகா. மோனிகா அந்த நேம்ல ஸ்டூடண்ட்ஸ் எதுவுமே ஏன் ரிமெம்பர்ல இல்லம்மா? பார்த்திருந்தா உன்கிட்ட ஜாயின் பண்ணிருப்பேன்மா. அப்படியா? ஓகே, ஓகே. இப்பவும் டைம் இருக்கு. இப்பவும் டைம் இருக்கு. உங்களுக்கு வேணாச்சா எகைன் ஜாயின் பண்ணலாம். நோ இஷ்யூஸ். கரண்ட்லி பேட்சஸ் ரன்னிங் போயிருக்கு. மீன்ஸ் அட்மிஷன்ஸ் எல்லாம் ஓப்பன் தான். So if you are interested to join my class, you can definitely join dear. Okay. No issues. Because already Akash Kumar is one of my student. No, joined yesterday. Agash joined yesterday and today is his first class. Okay. He also contacted me through this live session. And he is also from Tamil Nadu, Coimbatore. Yeah, sure, sure. Anatomy and terminology, medical terminology. Okay, okay. We will discuss it. Okay. No issues. Okay. Okay. So, okay, let's wind up this session. Any other queries, guys? Just DM me or otherwise can wind up this today's session. Okay. Okay, so um, levels of MDM. Okay, okay, we'll discuss. Okay, okay, guys. So shall we wind up this today's session? Okay. So see you in the next video, next live tomorrow 9 p.m. Don't forget. Okay. So anyway, thank you so much, guys, and yeah, good night, sweet dreams. Bye bye.